All right, guys, so I was actually putting together a custom plan for a patient, and I find that sometimes pictures are better than words. And so when I look at this area right here, I want you to pay attention to this, okay? So let me push play on this. And you see all that movement right there? Okay, so those are actually spirochetes. Now, spirochetes like anaerobic environments. And so what does that actually mean? Well, what that means is that's bad bacteria, and it's actually clustering together, which makes it even worse. So sometimes what'll happen is patients will brush, they'll floss, they'll do everything that we ask them to do, and their periodontal disease continues to get worse. The reason being is we actually are like going in the dark. We don't even know what kind of bacteria they have. We have no genetic tendencies for these patients to have gum and bone loss. And so without having this microscope, it's really hard for us to identify which bacteria are there. And without knowing which bacteria are there, it's hard for us to give proper recommendations on what these patients actually need to get back to a healthy state. Do they need more frequent recalls? Do they need additional biofilm removal therapy? What do they need? The bacteria is going to tell us a lot about what they need. So somebody that has very little anaerobic bacteria, or the bacteria that doesn't like oxygen, those are the bad bacteria that you find in the gum and bone that can create a lot of destruction. If they have very few of those, their recall schedule, the things that we do for them are going to be totally different than if you had that nasty stuff that I just showed you on the video.